Hello, I'm joined once again by my colleague and our clinical lead here at Attention to Health, Dr. Dietmar Hank. Hi,
Hi,
Dietmar.
everyone. To see.
I was hoping you could tell me a little bit more about ADHD, but also a lot of the co-occurring conditions that often appear.
Yeah, no, very happy to. So in the field of ADHD, we work with the assumption that ADHD comes with co-occurring condition. ADHD does usually not come on its own. Um, we look for and we almost expect to find other health-related difficulties people have, and that's borne out by the literature. That's
Mm.
in various contexts and across the world. Studies that have been performed have shown very clearly that more people with ADHD have additional conditions than not.
That makes complete sense. What, in your experience, because I can tell you my experience, what are the ones that you see most often?
Certainly amongst if we take it sort of chronologically from a developmental age, i.e. sort of toddler age, and then schooling, teenage years, what we often find is there is co-occurring autism type difficulties. Young people have that might not necessarily meet the clinical threshold for a diagnosis, but we do see difficulties along those lines. We see issues along the sensory processing, where people might be particularly sensitive to lights and sounds and things like that. We often find issues around coordination, that young people are less well coordinated, and then specific learning difficulties, dyslexia, dysgraphia, so difficulties forming letters and numbers, struggling to sort of the concept of maths, calculating, but also things like tick disorders. So that's in the sort of toddler school age group, and then as people sort of reach adulthood, we then see very frequently anxiety disorders and mood disorders, both in the form of depression, but also bipolar conditions, and unfortunately, quite often also alcohol and drug-related difficulties, which, again, in our experience, are often come about because young people find by drinking or taking drugs, they find a degree of relief from their symptoms, and then sadly they can slip into more habitual use of those substances. So that's a bit of an idea about the sort of developmental and mental health conditions that we often see alongside ADHD.
Yeah. What, particularly if you're working with adults, are there any sort of physical health conditions that you often see?
Yeah, maybe to say that sort of between what we might consider a sort of mental health and physical health is the whole area of sleep, which very commonly affected in a person with ADHD, difficulties falling asleep, staying asleep, not feeling refreshed in the morning, those kinds of chronic sleep-related problems, often going back to childhood, where we hear this person never slept well from the word go. And then in terms of physical health difficulties, we see problems managing someone's diet and weight. We see conditions such as asthma or migraine more commonly. And more recently, we've also learned about other chronic health conditions along the sort of fibromyalgia, chronic fatigue range of disorders, and also the sort of the whole what we call hypermobility complex that comes as a physical aspect of very bendy joints, but also often with other issues like irritable bowel or gynecological problems, aches and pains, that can cluster around the sort of hypermobility. So again, a whole breadth and range of conditions, and none of those lists I've mentioned is sort of fully inclusive of all of those conditions, but just give an idea
Yeah.
of what we see and look for.
I mean, as you say, the rule with ADHD is that it hardly ever comes all by itself. It's usually accompanied by a co-occurring sort
Yeah.
of problem.
Absolutely, and that's important to understand because it's not just in inverted commas the ADHD someone is struggling with, but all those other things dotted around it. And we often find that by the time someone gets to their 30s or 40s, that maybe the co-occurring condition has taken center stage, and the ADHD behind that is not seen. By the same token, if the ADHD is not identified, the chances of successful treatment and recovery in those other conditions is much reduced.
Yeah. And I think it's so important to have that good assessment and diagnosis of ADHD, because in my experience, and I don't know what yours is that if the ADHD is successfully treated, that can really make an impact on the co-occurring condition, even if it's just in terms of how it's managed, being able to take medication, being able to get to your appointments for, say, a physical health problem, remembering to take your insulin if you're diabetic. It can really make such an important impact.
You're absolutely right. For someone to embrace the treatment and the strategies for those other conditions, the ADHD often needs to be addressed first to allow people, as you say, to be consistent in their self-management and in their ability to buy into the treatment that's offered by professional. It's not that people don't want, it's just the ADHD puts barriers, the untreated ADHD puts barriers in the way.
Yeah. Brilliant. Thank you so much, Dietmar.
Yeah.